we're going to move on with the program, and I'm going to introduce our next speaker, Dr. Krystal Tomei, who's going to talk about the new physician leader. Dr. Tomei is the Reinberg Endowed Director of Pediatric Neurological Surgery at Rainbow Babies and Children's Hospital and an Associate Professor at Case Western Reserve University. In addition to being a gifted neurosurgeon, Dr. Tomei has had extensive experiences in medical leadership, particularly as an active member of the American Medical Association for the past 15 years, where she has served in a variety of roles, including currently as a member of the AMA Council on Medical Education. She also serves as editor-in-chief of Clinical Neurosurgery. Dr. Tomei has received numerous recognitions for her efforts, including the American Medical Association's Foundation's Excellence in Medicine Award. She was also the inaugural Anton Fellow at University Hospitals, which is a fellowship for physician leadership development sponsored by Carol and Arthur Anton. Dr. Tomei's training path includes the University of Florida, Rutgers, Phoenix Children's Hospital, and a MPH from the Harvard School of Public Health. She joined University Hospitals in 2014. So please join me in welcoming Krystal.
So thank you, Dr. Jane and Dr. McGarry, for this opportunity to come talk to you. I really wanted to talk about this as sort of a newcomer to the University Hospitals family. I really think that this is an honor to be a part of this new legacy of really valuing the educational contributions of our institution and the impressive contributions of our alumni. I wanted to talk a little bit about the new physician leader and physician leadership in the 21st century, and specifically highlight my opportunity as the Anton Fellow to really build upon that portfolio. So some of you may have seen this picture before. This is titled The Doctor. It is a painting that was painted in 1891 by Sir Luke Fildes. And this highlights many of the reasons that we went into medicine. That is that quintessential physician-patient relationship. You have the doctor hovering over the sick child, the parents in the background, placing their trust in them. And this is what drove me to medicine, and it's what drove so many of us to medicine. But that's not what medicine is anymore. It's so much more complex. In fact, this is medicine today. And it is this realm of a patient, a physician, and numerous layers of different aspects of quality, of financial institutions, of considering systems and socioeconomics. And the really important thing to notice here is here are physicians, and here are patients. And that direct connection that we so cherished has all of these intertwined areas. And it's no longer acceptable for us as physicians to value that physician-patient relationship without understanding the role that we play in the healthcare system today. And that's why I think the opportunities provided here in leadership development are so important, not only for those of us in our practice, but also those of us in training and understanding what role we have not only today, but in the future to really help shape the future of medicine. So putting this in the context of our UH mission to heal, I can think of no more important relationship that I have as a physician than that of my relationship with my patient. And that to me is the most important relationship that I have in healthcare. And we as physicians have the perspective to be able to provide the care that our patients need. We can also help to shape the vision of our system in a very patient-centric manner. We also have a duty to teach, to train the next generation of physicians, and that's what today is all about. Our role in the healthcare team also not just allows us to train our physicians of the future, but also to serve in that healthcare team, making sure that other clinical staff and non-clinical staff are equally invested in the goals that we have for our duty to our patients. And our input, as we continue to evolve this system, can help to shape the educational mission of our hospital. And finally, we have a duty to discover, or a mission. We play a crucial role in scientific discovery, and this was highlighted in Dr. DeGeorge's presentation. So much of what we're able to do in medicine today would not have been possible were it not for the contributions of physician leaders that came before us in innovation, in discovery. And our input can help to shape the research mission of this institution. And finally, we help to define the value that innovation and discovery is to the care that we can provide to our patients every single day. So with that in mind, in 2017, I was honored to have been chosen as the initial Anton Fellow. Our chairman of the board, Art Anton, had a vision of cultivating UH leaders, looking at individuals early in their practice and really giving them the tool set to be able to contribute to this institution. And he did this with 3 goals in mind: to build stronger, more effective representation of physicians in leadership positions, to drive a greater percentage of physician promotions from within the organization, and to enhance the strength of physician talent pools for future leadership opportunities. And everything about this fellowship was really centered on building a skill set that would allow physicians, such as myself, to develop those skills to help contribute to the system down the line. So with that, I'm going to talk a little bit about my experience as an Anton Fellow. And I think the most critically important part of this is it really is an individualized, tailored experience to the participants. So with that, I had goals while an Anton Fellow, and I had goals after my fellowship. And my goals as an Anton Fellow, as a fairly new person in practice, trying to keep my head above water and develop a new practice and be this new leader that I was sort of thrown into, was really to understand better the business side of medicine. And we all know that business and medicine is now so intertwined. So I needed to increase my business acumen, my understanding of finance. I wanted to be able to improve my strategic thinking, my long-term planning. How do you really think about that in the context of a 3-year plan and a 5-year plan? How do I manage conflict? You know, it's something that we all think about, and I think every one of us struggles with. How do I prove management skills? And I would say I'm probably a little bit of a micromanager, as one might expect a neurosurgeon to be, but how do I delegate appropriately? And how do I learn to do that so that I can help my footprint? And then finally, how do I learn to interact in these new groups with other physicians, with other fields, with non-physicians and other healthcare leaders? And how do I really improve my ability to function in this group to have a unified mission for the hospital? And after fellowship, I had very specific goals that I wanted to accomplish. For me in particular, that was strategizing the growth of the pediatric neurosurgery division, really improving the multidisciplinary programs that we had to offer, starting to think about how we can shape this into a pediatric neuroscience institute, drawing from the strength of the Neurologic Institute of university hospitals, and really how do we tailor that to the pediatric population of Ohio. And then how can I play a better role in the UH system? How can I not only help to forward the system, but how can I put my stamp on it as well? So with that, the Anton Fellowship was a year-long immersive opportunity. It was a deep dive into the UH system. I had meetings with university hospital leadership. It helped me expand my internal network. It helped me to get across functional exposure of healthcare and really understand our goal of systemness as we expanded our reach across Northeast Ohio. And really understand how the various aspects of our hospital system integrated with one another. So with that, I had opportunities not only to meet with and talk to different individuals in leadership positions, but also to shadow them, to come to higher level meetings, to really gain a better understanding of the system. And that included the chief medical officer, our former UHMG president, now our system CEO, our chief quality officer, the vice president of clinical integration, I had a chance to meet with the CMO of Conneaut, who was also involved in the high reliability organization, our chief patient experience officer, the chief administrative officer, the president of Rainbow, the vice president of human resources, and the chief strategy officer. So as you can see, it was really a very diverse experience and one that allowed me to see the system from so many different levels and facets. And also, they enrolled us in the UH Leadership Institute and focusing on the leadership promise of our institution, which had three main tenets. Really, how can I, as a leader, inspire? How can I help innovate? And how can I achieve? And this was a great opportunity because not only did this allow me to meet with other physician leaders, but it also allowed me to meet with leaders and managers across the system. I was sitting here side by side with managers from EVS, from our nursing services, from all of our therapy services and other ancillary services to really understand the role that we all play within this institution. And finally, the capstone was the Harvard Leadership course. To call it a 2-week intensive course is probably the understatement of the year. It is case-based learning at an intensity level that I don't know that I experienced even in my neurosurgery residency. They had multiple different subject matters to help give you an overarching experience of healthcare leadership, including strategy, operations management, finance, and I will never be more thankful than people that make spreadsheets for a living because I just had fun trying to read them. Leadership, health policy, conflict resolution. And it really focused on integrating all of the aspects of health policy, which is my background and my strength, with how that really affects and changes the dynamics of the healthcare system, considering both the financial issues, strategy decisions, and operation decisions. And then in particular, one of my goals was the tools and conflict management to really look at strengths and my personal reaction to conflict. This also included lots of tools and resources that are critical in that leadership development. And I think a lot about the difference between a manager and a leader. And really, when it comes to leadership, it's that personal introspection and understanding yourself, your strengths, your weaknesses, and how you function best in teams that really helps you to transcend that to that next level of leadership within a system. This included a leadership coach, a strength finder assessment, a 360 evaluation, and several of the courses within the UH Foundations of Leadership series. And specifically with that personal introspection, I don't think I have ever really looked at some of these evaluations the same since I've taken such a deep dive into understanding myself. And that included a strength finder assessment, really looking at where my strengths were in the realms of execution, influence, relationship building, strategic thinking. The 360 evaluation to really get an honest assessment of how others perceive you as well and looking at your emotional intelligence. The strength deployment inventory was done at the Harvard course, and it was fascinating because it not only gave me what my general motivational value system was, but it taught me a lot about how I adapted when I was faced with conflict. And that really gave me good introspection in how I need to pull on other people's strengths when I'm faced with these issues. And then resonant leadership, because we can't be good leaders if we don't take care of ourselves. And this was really focused on mindfulness and hope and really understanding the early signs of burnout and fatigue that decreased my effectiveness as a leader. And these experiences and opportunities to take a deep dive into my own personality, my own strengths, my own weaknesses, and not only identify them, but come to terms with them and think about how I need to work through them or work with them, really was invaluable. So with that, our Anton Fellowship here is really aimed and tailored at creating that physician leader of tomorrow. It is a phenomenal experience that is personalized yet broad. It provides exposure to general healthcare, economics, and policy, which really frames so much of our discussion these days. It provides a systems-based view of university hospitals. Really understanding the health system that you work in is paramount to being able to be an effective leader within that system. And it forces you to evaluate your own strengths, weaknesses, and interpersonal relationships. So with that, it was truly a fantastic opportunity for which I am forever grateful to the Anton family and for the UH leadership for allowing me this privilege. And with that, I really want to reflect on what is this new physician leader? What is this physician leader of the 21st century? How do we keep that patient-physician relationship at the forefront and allow ourselves to be a part of this system that's ever-changing and more complex? And to me, that's understanding the relationship that is at the core of everything that we do. That is understanding the intertwined nature of healthcare policies and the realities of patient care. I think we all experience frustrations every time something comes down the pipeline and we have to change the way we're doing something because of a new policy. But we have to understand the reality of how that plays with our patient care. We have to understand the business. So much of what we do is a dual meld of that duty to our patient and that sort of combination of our patients as both patients and customers of the healthcare system, as much as it pains me to think of it that way. We have to be able to understand the strengths and weaknesses of the healthcare systems in which we work. Without understanding that, we don't know how to make it change. We have to know how to influence and inspire positive change in our colleagues, in our systems, in our trainees. We have to have the leadership skills to be able to understand our own effectiveness in teams. We have to be fluent in both medicine and business. We have to know our own strengths and weaknesses. And most importantly, we have to be mindful of not only the wellness of ourselves, but the wellness of our team members. And I think that this is, although it's a far cry from the doctor of 1891, I think that this is the physician and the physician leader of tomorrow. And I encourage all of you to consider the opportunities that you have to grow yourself as leaders, to grow yourself as educators, to grow yourself as innovators, because that is really how we get to impact our patients the best. Thank you.
Thank you very much, Dr. Tomei. And, as I was listening to Dr. Tomei speak, and I'm looking out at senior leaders within the audience, Dr. McGarry, Simon, and others, I have to say, when you see the next generation of leaders like that and the other Anton Fellows, it really is very inspiring and fills one with confidence, the future of this organization. So thank you for your remarks.